The big day has arrived. Your box of snaps has turned up in your department, and I wanted to show you the box. So this is our box of snaps from DTR Medical and Endoscope-i. The most critical part about this label is the QR code here. If you, on your smartphone, open your camera app and look at the QR code, it will take you to our instructions. Inside the box, there's three components to the snap: the base, the valve and the trocar, and on the back you again have our instructions.
So Chris, tell me, what is snap?
Snap is a dynamic one-way valve that allows a clinician to perform an endoscopy of a patient and minimises the risk of transmission of any droplet spread from the patient to the clinician.
To assemble your snap mask, you simply place the outer component on the outside of the mask approximately a centimetre or just below this white band at the top of the mask. When you turn the mask around, you can place one end of the snap valve in and then just simply snap it in place. And then with your trocar, punch through, rotate round about 10 times just to make sure that there's a good hole inside the mask. You'll see on the other side that it appears that the valve is open, but this is a dynamic valve, and as the patient blows into this side, it will actually close the valve down. As a head and neck surgeon, I perform about 20 nasal endoscopies now. It's a significant reduction in the number of scopes that I used to perform, but it still maintains my service in terms of the 2-week wait early cancer screening. So it allows me very safely to then perform these examinations, to look into the nose and into the throat using the nasal endoscope, but importantly it allows the patient to maintain wearing that mask at all times whilst they're in the clinical environment. There are 3 steps to using the snap. First of all, making sure that the snap is adjusted in the right position just at the base of the nose. The next step is threading the scope through under direct vision, passing this through the snap valve. Threading the scope can be done in 2 ways. When your scope is a 3mm scope, you can simply just look directly at the snap and just pass through the valve. When you're dealing with a scope that's slightly wider than 3mm, what you need to do is stabilise the base of the snap and hold your endoscope in one hand, ensuring that the tip of the scope is nice and straight. Staring directly at the snap, you thread through under direct vision and place that through the valve to then eventually reach the alar of the nose. Intuitively, when you're performing the thread technique and as you're passing through the valve, you'll be looking at the screen. The problem is, as you manipulate the tip of the scope whilst you're looking through the screen, what will happen is, as you meet the resistance inside the valve, you'll get buckling. What you want to ensure is the tip of your scope is completely straight, and then you want to thread this right through the mask completely straight under direct vision looking at the snap valve. When you do that, you'll find that actually the scope passes right through the valve without any resistance at all.
Would you use 1 or 2 snaps on a mask?
So when I started performing nasal endoscopy with a snap, it's certainly a difference to the way in which I've normally performed the procedure. I've done thousands of nasal endoscopes, but having to do something different with navigating through the mask posed a little bit of a challenge. Using 2 snaps allows some stability, so places essentially one valve towards each nostril. It's a lot more intuitive for the patient when they're putting the mask on, and it makes it a little bit easier to pass the scope through, just in case one nasal passage isn't clear enough. You can easily just switch around and go through the other valve. As you become more proficient with nasal endoscopy through a snap valve, actually you find that you quite get used to manipulating the valve around. I tend to use one side normally when I scope. So I now, having done a few hundred of these through the snap valves, I'm now quite happy performing nasal endoscopy with just one valve. So I think when you're learning, when you're starting off, it's a good idea to use two. What you want to avoid is the snap valve sitting too low in the mask. Here you can see this one's placed right in the middle of the mask. The problem here is that when this is fitted to the patient's face, it will actually mean that this top part of the mask, which is now probably about 3 centimeters, is going to cover too much of the patient's nose and almost cover their eyes as well. So this is not going to be stable enough for nasal endoscopy. Ideally, the area that you want your snap valve mask is just below this white band here in the center.
I'm wearing an FFP3 mask. Why would I need a snap?
I think the brief answer is you wouldn't. It stops you being exposed to the risk of aerosol or droplet transmission, and therefore actually that's an entirely acceptable thing to do. I think the problem with continuing to wear FFP3 mask or N95 mask are a number. If we're going with a FFP3 or N95 mask, I think that means that any other staff in the room would need to wear it because they would also be protected, and this can then lead to a supply issue where hospitals are running out of supplies of masks. I think it also then leaves the patient open, and therefore any droplets that come out will go into the room, and therefore it then requires room rest, which, depending on the ventilation of your rooms, seems to vary between 20 minutes and half an hour. So therefore has a massive impact on your clinic, and you can't really see the number of patients you need to transact to successfully run your practice. It's really hard to communicate wearing an FFP3 or an N95 mask. It's really hard for the patient to understand you, much harder than a conventional surgical mask, and it's uncomfortable. Actually, we don't like wearing them. So they're the number of reasons why we think using a snap mask is better than just continuing with a N95 or FFP3 mask.
So why not just put a hole in a mask and scope through that?
Yeah, it's an interesting point, and one that we've assessed actually. It kind of makes intuitive sense that would be useful. During our particulate measurements, when we looked at a mask with a hole and a mask with a snap mask, we found that actually when you have a hole in the mask, you don't actually reduce the amount of particles coming away from the patient that much. Obviously some of them go into the mask, but most of them are channeled out through the hole and go straight at the clinician. So actually we think it's probably worse than not wearing a mask at all.
Would pulling the mask down and uncovering the nose be a safe way of scoping?
In short, no. The risk when you endoscope someone is that they cough, splutter or sneeze, and then you will get droplets coming out their nose. That's the whole reason behind the recommendations that we all wear face coverings. And so to actually come to a place that increases that risk and not have your face covered seems a bit crazy, to be honest. So actually the ideal position is you maintain a face covering and you safely endoscope through it. Thus the design of the snap.
And would pulling the mask up to expose the mouth be acceptable?
There's one occasion where you would need to consider pulling the mask up, and that's when you're performing a fees examination, so an endoscopic evaluation of swallow. This is a very different procedure to the nasal endoscopy itself, because this one potentially will produce aerosols because you're assessing a patient's swallow, which might make them cough and splutter. So it's very important when you're performing the fees evaluation that you have the full level of PPE. So this is using an FFP3 mask, a visor, surgical gown, and your gloves as well. So you will have that additional protection because you're physically going to be doing a different procedure. Using a mask with a snap fitted confers an added benefit, and certainly when you're assessing swallowing with liquids, for example, you can use another valve and pass a straw through the valve and assess swallowing liquids through that quite safely while maintaining the mask on. But if you're assessing things like yogurt or biscuits, the only way of getting that into the patient's mouth is to lift the mask up. But you've got the added benefit of wearing your full PPE anyway. What we try and ensure is that when the patient has the food substance in the mouth, before they begin to swallow, they'll put the mask back down to cover the mouth, so the snap valve has got the endoscope through there, and you've still got that added protection just in case they do have any problems with swallowing, they're aspirating, they cough during that time. So it still protects you with droplets, but it's just getting used to that new process of performing the examination safely.
So, we've got a filtration unit. Why do we need anything else?
So this goes back to the science of transmission. 3 modes of transmission: droplet spread, the saliva from coughs and even talking that comes out of our mouths; aerosol spreads, tiny bits of fluid that we can't see; and fomite spread, when I touch my mouth, touch a table, someone else does the same. The filtration unit is good at turning over the air within a room and therefore getting rid of any aerosols within the room. Aerosols, remember, are a very small mode of transmission, and the big one is droplets, when we cough or sneeze into someone else's face, or speak, which goes into someone else's face and down into their respiratory system. Your filter unit gets rid of the aerosols around us, but won't stop that droplet spread, and that's the main mode of transmission. So it's easy to think, I've got a filtration unit, I'll be fine. Actually, that probably won't protect you much at all, if truth be known. It's droplet spread that is the principal spread of COVID-19. It's similar to all infective respiratory conditions. And so thus the reason that we've all been recommended to wear face coverings. And it's droplet spread that we need to try and minimise. And given that nasendoscopy is a procedure that can produce droplet spread by the patient coughing or spluttering or sneezing during their examination, wearing a face mask throughout that procedure seems like the most sensible thing to do. The problem is you can't endoscope through a face mask, thus the design of the snap valve.